ABC Connecticut News at 5.
In tonight, to be healthy, a Connecticut doctor is doing hip replacements without cutting through a single muscle. We're learning how and why this new approach has such a promising future. When Morris Laviero's groin pain made it hard for him to sleep at night, he knew something was wrong.
After a while, I said, that's enough.
Shape as well.
That's when Morris found out he needed a hip replacement and decided to go with Bristol Hospital's Dr. David Rubins.
Last time the x-ray looked good.
But Dr. Rubins does things a little differently. He uses a new, less invasive approach to hip replacements, and he says he's one of just a few doctors in Connecticut to do so.
2 years ago, I started doing the DA hip approach, and quickly I saw the difference in my patients in terms of their recovery and going back to work and going back to driving and going back to sports and just their general happiness after the surgery.
DA stands for direct anterior, and Dr. Rubin says this approach differs from that of a typical hip replacement because it doesn't cut through muscles.
The muscles that we are going through, we don't cut them in half and we don't release them off a bone. We literally sort of spread them apart layer by layer by layer until we get to the hip joint.
And that makes way for a much faster recovery time. A typical hip replacement patient takes about 3 days just to get out of the hospital versus the DA approach.
Most of my hips are going home in 2 days, and some of my hips are going home the next day after a hip replacement.
And in Morris's case, so far, so good.
I feel great. I feel good. The procedure was done on a Thursday afternoon. I was home Saturday afternoon.
That's fantastic.
So just 2 nights in the hospital and home.
Getting around nicely there. Dr. Rubins adds that the direct anterior approach isn't for everyone. Ideal candidates are in relatively good shape and have good bone quality without severe osteoporosis.
Stay with us. There is much more local news ahead at 5:30.